physicians.
Yeah, excellent. Okay, wonderful. Well, it's great meeting all of you. So just to give you a little sense of who I am, um, I'm a third generation Californian. I grew up in Southern California. I did all my education here in California, and then I left for a really long time, like almost 30 years. I did my residency in Boston at a primary care internal medicine program at the Brigham. And then I went and did a special research fellowship called the Robert Wood Johnson Clinical Scholars Fellowship. It doesn't kind of exist anymore. It does in a different form. But one of the reasons why I did that is I got really motivated as a medical student at UCSF, just really passionate about the experiences of my patients that I saw and learned from at the General, about the importance of reducing health disparities and advancing health equity. And I recognized from a lot of my colleagues and my mentors there that you can often make a big difference if you do policy relevant research. So research that can inform policy. I know that seems a little bit like a non sequitur right now because there's not a lot of scientific basis by which their federal government is making decisions right now. Either scientific, economic theory, a lot of proven things and patterns in science that our current administration is not acting on. But usually the case is, and I do believe strongly that the case will go back to, we will go back to where we were only 3 months ago, because it will become very clear. It is becoming clear and will become clear even more how important science is, how important basing policy on evidence is, how important it is to take care of our population, either be at the state, our community, or federal level. So that's kind of why I got interested in doing research, because I really wanted that research to inform policymakers. And one of the reasons I got interested in that is that this is something you can think about when you're in your practice or where you're working, is that even though I speak Spanish, I noticed that my patients who speak Spanish weren't getting the things that they needed. And when I asked why, they basically said, "Oh, so then when I left my office, I realized that there wasn't signage in Spanish. Then I asked, are there interpreters? There weren't interpreters. The concierge at the opening of the front of this clinic actually were bilingual, but do we know how adequately bilingual they were to interpret? I don't know, but they would be called sometimes to interpret, but obviously they had another job. And so there was a lot of linguistic access issues. So then I asked, why don't we provide interpreter services? And they said, well, it's an unfunded mandate. So there are some federal and rules that apply to providing access to care in a language a person can understand. But it's not funded necessarily, although there's lots of things that are unfunded in healthcare. And I said, okay, that's interesting. And I said, well, what are you paying for not providing these services? Are people getting worse care? Are they having to come back more frequently? Are other bad things happening that are costly, both for the patient individually as well as, for you, the healthcare system? And they said, we don't know. And so that's how I started my career, is really looking at the cost benefit of providing linguistic access services. And it really came from a passion for patient advocacy, because I wanted to be able to provide data that showed that providing interpreter services really helps patients and helps systems. And so I've done like a lot of that work, and that just is what set me on the path that I have today. And then I am just very passionate about politics and policy, and it's just, and I think it's not like I was a biology psychology major. I never thought I was good at writing. I never thought, I mean, I was allergic to history. I thought history was my worst subject and all those sorts of things. Now I've learned a lot of history because it really does influence where politics are today, political history. And so, but now I'm very immersed in it. I follow it very closely. And then I've done a lot of advocacy around it. So how have I done that in my own personal life? So I personally do a lot of letter writing. I write invited commentaries. I write opinion pieces in different forums. I will call my state and local representatives. I will call my state and federal congressmen, so senators, for advocacy. And then I participate in my professional organizations in helping advocate. So um, right now, people are talking about the AMA being somewhat quiet on this, and unfortunately, they have been. I know Manny's like, yes, they have. Um, but there are other organizations that I belong to who are very active. So I'm a primary care physician, and I belong to the Society for General Internal Medicine, and I led the health policy committee for them for like 3 years, and I've been a member for forever. And I'm now an elected leader. I'm treasurer of this organization, and we pay a lobbyist locally to advocate on behalf of issues that are really important for um, our uh, our membership. And so that has to do with equity. It has to do with evidence-based medicine, not having the government interfere with speech that happens within a patient-doctor relationship. So if I want to advise someone that related to termination of a pregnancy, that be protected, for example. We do a lot of advocacy around funding, Medicare, Medicaid, funding of research. So NIH and this agency called the Agency for Healthcare Quality and Research. And so they give us guidance and we give them guidance on what to advocate for. And this particular advocacy group that we work with that we pay for is called CRD, and they work really closely with the American College of Physicians, which is a very powerful group. And if you go to their policy advocacy page or you look at their white papers or their statements on different issues related to health policy, they're also very active in that space. And so we work closely with them too. So those are some ways that I've continued to be involved in policy. Um, I think also the other thing that's been a real amazing thing in my career is that through my research, I got recognized as an expert in delivery of equitable care, particularly in the setting of um, if a patient and a health system have different languages that they prefer to communicate in. And I got to sit on several government panels. I've been able to contribute to white papers. So sometimes doing research or policy relevant research is also a way to really contribute to policy, not only from the aspect of like it's published somewhere, but that gets you attention that people say, oh, this person really understands this issue and kind of what are some solutions that we need to advocate for. For me, it was adequate linguistic access for our patients. And so those are just some different ways that I've been able to be influential. I personally think whether you're going to do it at the federal level, the state level, in your local community, at the school board level, I forgot, I sat on the health committee of a school board in Austin, Texas. And that was interesting because Austin's a very conservative place. And this was during a time when they were revamping their entire the education for kids around bodily autonomy and sex education. And there are a lot of people who didn't want us to teach people different parts of the body and where it's okay to be touched and not to be touched. And so there was a lot. So just serving on that committee was very influential to this very large community, Austin, Texas, which is a very large and growing community in Texas. So there are just so many ways as a physician who's known to be an advocate and has expertise or ability to bring thoughtful expertise into a space to advocate. And so don't also discount developing that expertise in the area that you're interested in, because that will give you opportunities that maybe you're not even uh, purposely seeking out, but would like to have. So I think I'll just stop there. I just give you a lot of information and see what kind of questions you have for me about it um, and my career.
Awesome. Does anybody have any questions?
So, what was like the first part where you felt like you kind of knew what you were doing in this space and felt confident?
Oh gosh, so that's a really good question. It's like anything. It's after I did it a couple times and I figured out what works and what doesn't work. A lot of times you can get coaching. For example, there's the UC school, well, there's some other California schools, but it's led by someone from UCSF, has an advocacy course that they put in for internal medicine residents every year. And then they take them to Sacramento to advocate at the state level. And I've done some of those things as well, like that CRD that we talked about. I can reach out to them as a member of my professional organization and get coaching. How do you do it? They'll give you really great guidance on that. And it took maybe 2 or 3 times of doing it and being in someone's office that I felt comfortable. Yeah.
If you want to talk a little bit about kind of your master's in public policy program and how that kind of helped you continue to grow kind of educational route rather than on the ground, more grassroots advocacy.
Yeah. So when I went to my fellowship program, it was at the University of Chicago, and they have a great policy school there, the Harris School. And we had to take certain courses as part of our fellowship. And through that, you could also complete other courses and finish your get a master's in public policy. And so I did that. I'll just tell you, it was very hard because I was so tired with school. By the time you get done with, residency and all your boards and everything, and I was like, oh my God, I have to turn in homework again. Like, I am not ready for this. So it was a little bit hard, I have to say. But I'm not sure they taught me a lot. I think it gives you the cachet to have the degree. But really, actually, the expertise that you develop, like if, for instance, you're really interested, someone was talking about houselessness. So if that's something that you're really passionate about, thinking about doing some sort of work in that space, maybe even going to a known residency program where they actually have a track in that, because there are residency programs that have a track in that in internal medicine for sure. Then then you get known as someone who has understanding of the issues that the patients face. And I think that's more important than a degree, honestly, I would say. And it was really hard to go back to school. I was like, no, homework? Are you kidding me? Like one day you're coding someone, you're responding to a code and they're like, but you must turn this homework in by 5 a.m. I'm like, really? Okay. So it's hard.
Awesome. Go for it, Manny.
Okay. What advice would you give to people like me and Sonia? We're both a part of like the AMA medical school section, and then we're also like on like some of the subcommittees. But like we kind of found out that there's a ton of bureaucracy involved, even just introducing a bill to other medical students before you even get to the positions. Do you have any advice for any national level work with things like that?
Yeah. I mean, the AMA is a large and very bureaucratic organization, and it is really governed by by the physicians who are members and have been members for a really long time. And the way you rise up the ranks in the AMA to like become president or have, a governor, that sort of thing, really comes from kind of being a part of the system. So that one's a lot harder to change, I would say. So I would recommend, I think it's still good though, because if you're part of the organization, it's you can't really change organizations from outside, but as a member, you have more opportunity. But local AMA chapters, maybe, are there ways to get involved in organizations that have that are smaller? Like, so for my organization, SGIM, we have student representatives as well. If you're interested in potentially being a primary care internist or going into hospitalist medicine, that's who our membership is. There's lots more opportunity for you to be influential because it's smaller and it's more grassroots than it is like a large bureaucracy that's really trying to meet a very broad swath of physicians. So my advice would be to keep at the work, but think about, are there ways that you would do something more in a smaller setting, like in a regional meeting or at like in an organization that's smaller than the AMA.
All right, go for it.
Yeah, so I just had a question. Given the recent administration's kind of going ons and actions, I was wondering if you've already had to face some sort of setback with the advocacy work, especially when you bring in like the importance that research brings to it and having grants being cut for including certain words. And if you've found like a way, or maybe working with a team or something to find a way to work around that in the meantime as people are getting their feet back into figuring stuff out.
Yes, oh, definitely. I can give you lots of examples of what's been going on. So one is that we recruited a new vice dean for clinical research. He's coming from UCSF. His name is Dr. Robert Rodriguez, and he's done a lot of research. He's emergency medicine and critical care medicine, and he did a lot around COVID and long COVID and vaccine delivery, especially to reduce. He's bilingual, bicultural, and especially to reduce vaccine delivery disparities and acceptance disparities, engagement, and he had a whole grant on vaccine hesitancy that he was in the middle of, and he just got an email one day and they said, we're canceling it. There's no appeal. They just canceled it. So then what has to happen is local organizations or states or other organizations have to figure out how to support that kind of work while we go through this temporary time. I do believe this time is temporary. It is it, it my personal perspective is that a lot of public health and a lot of the importance of research in our country is it's silent. People don't see it. And so they take it for granted. I tell people this all the time. People take the government for granted. They think they pay taxes and they complain about them all the time, but they don't understand what the government does. People don't understand that um, Medi-Cal is the federal government. It's Medicare. It's called something different in every state. And in God, what was it called in Maine? I'm blanking what was called in Maine. So people don't even, and there's a reason. So people are like, oh, well, if they also get Medi-Cal, right? If they cut Medicare, I'm like, no, because it's just Medicare administered by the state of California, because each state can do it a little bit differently. And the ACA, people don't understand the Affordable Care Act also is something that expanded healthcare, and people don't understand that they're benefiting from that. People don't understand that they're benefiting from that they don't have to pay for their mom's housing because she gets a stable Social Security bill every month. But people don't know that. They just kind of take it all for granted. And I think as people have been saying, what is it? FAFO. So this is the find out part of, our what's going to happen. And people are finding out. I mean, it's it's going to take a while to swing back because there's been a lot of dismantling, and it's very purposeful. If you've read Project 2025, it is very depressing, but it is exactly what's happening right now. And they want to take away a lot of the infrastructure such that it would be really hard to rebuild to reduce the government footprint. But I do think we'll go back there because you can't be a country that's leading in innovation, leading economically without science, without education, without an educated populace, without doctors. I mean, we already have a shortage of doctors in some areas for sure, and many parts of this country. The red state's the worst. And so I think it's then how do you, sorry, I went on a little diatribe there, but I'll reel myself back in. So that is that I think it's really important that we try to think about how do we support people and important projects and things while there might be temporary disruptions to what's happening. And I think we haven't figured out how to do that because it's just happening so fast, but I think it will happen. And this reminds me of one more thing, though, is that I am shocked by so many people who do not follow what's happening right now. And that's I think, an entirely discounted area of advocacy of individuals. Maybe patients sometimes, but sometimes you don't want to interfere with the therapeutic alliance, but neighbors, friends, I talk to my Uber drivers every single time about different things. I tell them what I do, and I'm like, oh, did you get the COVID vaccine? Or why or why not? I might have a conversation with them. So I try really, I also think that there's a lot of mis and disinformation out there. If people go to one news site, they're not going to get complete information. And so I really work hard also just local advocacy, individual advocacy with individual people. That's really what's going to make a difference when people vote a different way. So, and when they find out and they decide they're going to vote a different way. So I wouldn't discount that either. A lot of individual advocacy.
Kind of related to voting patterns and understanding now that at the federal level, a lot of health decisions are being imposed on states. How do we kind of, in our little Southern Californian bubble, support medical students in red states or states that have like heavily restricted curriculum, especially knowing that these people might be our colleagues in California or vice versa. And I know some initiatives, especially with abortion access, to have them train at different programs that allow them. They have trying to figure out a lot of like crossing, but again, that just leading to a lot of burden and obviously difficulties in the coordination. But yeah, from your opinion, from your any advice that you can give on how we can support our future colleagues in other states.
Yeah, that's a really good question. Well, first of all, I think it's so important to think about how we continue to support these things, um, but in a way that we hopefully fly under the radar. So I think, Andre, you were saying like changing words, or calling it something else. So that's where I would start. So like for instance, at the AMA, maybe you're gonna have at your annual gathering, you would have a meeting of like medical students interested in evidence-based reproductive healthcare, something like that. And then where you get together and you talk about, okay, what do we do in these settings? It's not necessarily recorded. There are individual networks. I mean, this is how resistance has always been done, is through kind of underground ways, through personal networks. So I think there's many ways that you can develop those personal networks and try not to make it big and flashy, because then it might gather attention and something might happen to it. So I think thinking about how you talk about it, but in a way you get the right people into the room, and you're able to, you know, be a resource even to them in that way.
A little earlier, you talked about how people like will kind of eventually get it, like the impact of like destroying science programs or like not funding them. And you said they're kind of getting it now. In what ways do you see people's perceptions change in regard to the current administration's action?
Yeah. So I'll think of a couple examples. So one is, so there's this measles outbreak in Texas. It's in this community where near New Mexico, it's also spread in New Mexico now, where only 80% of kids were fully vaccinated. But then, you know what they did? They set up free vaccines and people were lining up to get their MMRs and for their kids. Unfortunately, not one of the families whose child died. They somehow still believe that that was the right decision for their child to not vaccinate them. That led to that child's death. Um, and that just shows you how extreme some people's beliefs or denial can be. You know, as one of my colleagues said, maybe they can't really admit that they maybe could have prevented their child's life. That would be really hard for them to say. So they're in a, they've doubled down on this other way, more in an unconscious way, I think, because they lost their child. So that's one way. I think um, it hasn't hit in other ways yet. Where it is going to be an issue is that, for instance, people aren't going to want to come and study here anymore. advances in there are scientists leaving this country and going to other countries and developing pharmaceuticals and vaccines and doing things that will material science, things that are going to be really important for future economies. And they're not going to be part of the United States anymore. And so that hasn't hit yet, but it will. One thing I think is that, people can see their friends and colleagues losing jobs because a lab may not have federal funding anymore. So also, again, it's local. Like if you know a scientist who lives next door to you and they're like, all of a sudden their house is up for sale. Why is your house up for sale? Oh, because I can't afford to live here anymore because I lost all my funding and my organization's not supporting me. I mean, that's just an example, but the measles is the most immediate one that comes to mind. Um, yeah.
I saw that you did a talk with Dr. Carpiano, who, for reference, he's also one of our advisors, and he's at the School of Public Policy at UCR. But how and this whole club is kind of based around that idea of these like joint conversations between people in policy and then people in science. So if you could just tell a little bit about your experience with that conversation, and kind of what different aspects were you able to bring to the table.
I'm trying to remember what did
For you,
I did meet, oh, I,
Dr. Richard Carpiano.
I don't think I've met him yet.
Okay, I think it was published together though. So kind of the aspect of bringing in the policy side with medical side. I can send you a link.
Oh yeah, I don't remember what this is. Sorry. Yeah, send me a link. Is this the one about bird flu? Oh, okay. Yes. Sorry. So I didn't write that. Basically, I was interviewed by someone in the media office here, and they really that's actually a really interesting story because it got picked up by USA Today. I was quoted in USA Today out of that article, and the reason why is because they shut down the CDC, the federal government. And so then people are hungry. That's another thing. If you're known as a local expert, or you even, I mean, I'm not necessarily an expert in bird flu, but I read up on it and I understood what we need to do to prevent it and what I would advise a patient, a human being. And so that's what I wrote about. I can't remember what he added into that article, but it got picked up by USA Today because there was a vacuum from the CDC side about it. And what I'll tell you about bird flu is that that's where I also think people are going to find out. We don't know what's going on with bird flu right now because they're not collecting data on it. This is also something also that you need to advocate for. So another example is, women are dying or are permanently harmed by not having access to abortions when they have non-viable pregnancies. And they're trying to, they're not collecting data. Or if they are, they're not publishing that data and they're keeping it quiet as to how many women are being harmed because they don't want to, they want to say that they care about women and their lives when that's not borne out by the evidence. And so that's another thing that's really important to advocate for is the collection of data, not just what can we do if there's a bird flu outbreak, but how do we know there's a bird flu outbreak? So yeah.
Does anybody have
So
any?
so I think it's really great to the other thing that I think is fantastic about working with people in policy on the policy side is they fully know, like they're going to be more entrenched in, like for instance, there's this crazy weird policy thing right now, and it has to do with the insane way in which they price medical services in this country. Okay, and it all comes from the AMA. They have these relative value units. It's determined by RUCA, which is the Relative Value Unit Committee of the AMA. I think that's what it stands for. And it's very historical why surgeons are paid more than someone who, does primary care. And it's so entrenched in these groups that they lobby for it. But in any case, to make a long story short, in the first Trump administration, they decided Medicare is getting too expensive, so we're going to cut payments to physicians for care that they provide, and it's by like 2.5%. I think that's what it's something like that. It's 1.7 or it's 2.5%. Okay. So then there was this outcry, and some organizations like the AMA said, you can't, yeah, you can't do this because like we don't have enough doctors, and doctors aren't going into certain areas because they don't get paid enough anyways to see patients, primary care. And so they said, okay, we'll temporarily hold the cut, but it was still there in the law and in the policy, and it expired. And so now physicians are getting, even though with inflation and everything that's going on in this country, we got a pay cut through Medicare. And a lot of times, uh, private payers actually follow the Medicare market and the Medi-Cal market, Medicaid and Medicare. Sorry about that. And so, um, why was I saying that? What were we talking about? Policy. We were talking about, oh my God, I'm sorry, I just lost my train of thought. I'm explaining to you all these geeky things, but about Medicare payment. But so I totally forgot what I was going to say. What did you ask me, Sonny? We were talking about. Oh my gosh, I'm so sorry.
No, 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 you're so good.
Awesome.
About just kind of joint messaging from policy and
Oh yes,
yeah.
thank you. That's what we were talking about. So they understand those cuts, but you see what happens to patients and to your practices when that happens. The real world experience is so important to be partnered with the wonky understanding. Do you know what I mean? And I don't mean that like pejoratively. The wonky part is like incredibly important to understand from a health policy expert and advocacy standpoint. But because you also know where to go in different parts of the legislature to advocate for this. And so that's why I think that those partnerships are really important. So I can go and advocate I can see what's happening in primary care, but having someone really understand the cuts and how they should reverse them and how they can reverse them, which is something I can't always take a deep dive into, is really great to have that partnership. Thank you for helping me remember what I was trying to say.
No, thank you for that. And I just put into chat, but someone had asked through the form, what are some issues in healthcare that you'd like to see addressed? Which I know you've kind of touched on. And I think related to what we were just talking about was, could we advocate for primary care physicians to be paid more?
Yes. Okay. So this is interesting. My entire career as a primary care physician, this has been an issue. It's continuously an issue. But there's been some progress because my organization SGM went to other organizations like endocrinologists, nephrologists, neurologists, rheumatologists. We called ourselves the Cognitive Care Alliance because what we do is we provide cognitive care. We're not providing a procedure necessarily, but we're providing an understanding, an access point, a diagnosis, a starting of treatment, an understanding of the whole person, that sort of thing. And so they did advocate for some payment reform that has increased payments for cognitive care. There's another code that you can add on now. They went through the RUCA, and that's how it happened because they went through the existing policy structures. As much as they don't agree with the existing policy structures, they realize the way to make it happen is to go through that existing policy structure. So it is really important to continue to do this. And why is it important? I think a couple of ways to be an advocate for primary care is I think we really need to there are ways in which politicians who currently support this administration, their populations are being very hurt by this. So, for example, there are these critical access hospitals in rural parts of the country. Like there are some places, I can't remember, maybe it's New Mexico, could be Montana. You cannot, there's no OBGYNs within like a 200-mile radius of most of the state. So if you want to deliver, you like have to go to Bozeman, and you have to stay there until you have your baby. So one of the things I think is so important in policy is to understand where if you might really disagree with people, do you have some common goal or shared interest? And so for me, it would be going to those in power right now, which are Republicans, and helping them understand the ways in which their states are going to be materially impacted by some of these policies that they're trying to pass, or not adequately funding primary care. So that's what I would say about that. Oh my gosh, what are the important issues in healthcare? Um, so I mean, we should really have universal healthcare, and it should be really administered by the government. I know there's a whole anti-government, dismantle the government right now movement, but you save a lot of money that way that you then put directly into healthcare. When venture capitalists see an opportunity to get money out of the healthcare system, you know that we're putting too much money into the healthcare system in ways that are not beneficial, and somebody else sees a way to take that money out of it. So they're buying dermatology practices, they're buying dialysis centers, they're buying infusion centers, because these are places that can get paid a lot of money. But there's probably money going into them that we could put directly into healthcare, but because of administrative burden, not having universal healthcare, all those sorts of things, we pay a lot more than we need to. So when I went to medical school, we spent 13% of our gross national product on healthcare. Now it's 21%, 22%, I think. Do I have that right? Something like that. And I can tell you that when I was in medical school, everyone said, this is not sustainable. There's no way that this is going to get worse. And it has. We can still do something about it. We still need to do something about it. So those are some really big issues, I would say. Are you Googling it, Sonia? I think it's 22%.
I think it says, or it's Google AI. In 2023, it says 17.6, but
Oh,
I know
17.6. Okay, all right.
that number has changed.
Okay, no, 17, it could be, it's still,
Absurdly high.
it's
Yeah.
almost 20%. It's almost
Yeah.
20% of our gross national product, of what we generate in
Right.
our economy goes to healthcare.
Yeah. And my favorite graph is the one that shows that out of like the 11, out of 11 countries, we're like the top spenders and have the worst health
Worst
outcomes.
outcomes,
Yeah,
yeah. It shows
definitely.
you that we're not doing what we could be doing, yeah.
Right. And that's why I appreciate you kind of talking about with your own advocacy project with the translators of like putting into words that they understand. So yes, fiscal analyses of it, like you are literally losing more money by not providing this equitable care up front rather than later on. And I think that sort of research is super powerful because if that's what they care about, then you're kind of talking in their language. And I also appreciated how you talked about kind of the grassroots, like in my mind being like in the field in primary care, like that's your way of being at the grassroots, but even
Mhm.
local legislators being able to see what's happening in their constituencies and take it up to the federal level, like that's another way of like working together at the grassroots level,
Yeah,
which is kind of the only way that we can make a dent in whatever is going on.
yeah.
Yeah. Does
I
it?
love being a primary care physician too. I mean, that's a whole nother topic, but one of the reasons I love it is just I love getting to know patients and having a relationship with them. Now that can happen in other fields as well, but it's just such whole person care,
Mhm.
which I think it's very rewarding. And you develop relationships with people that you know for a long time and make meaningful impacts in their lives. You can see it by partnering with them in their care, and it's really rewarding.
Right. And I guess the last question from my end, is I don't think we've formally introduced your role at UCR.
Oh yeah, I
If you
didn't
could,
say it, did I?
yeah, but if you could share a little bit more about that and what type of like kind of led you to more of an academic side of whoa, cannot speak either. More of the academic side of medicine, and how you're able to take advocacy from kind of like institutional standpoint of medical education.
Yeah. Yeah, so I'm department chair of medicine here at UCR, and I got really involved. So it turns out that I really like leadership too. I really like working with groups of people and supporting people in achieving their goals. And I realized that I can have a greater impact on health equity, diversity, equity, inclusion, all those things as a leader than I can in my individual practice or in my individual research. All those things can matter too, but I get to have a seat at tables that not always people are at who are understanding these issues and advocating for patients and communities and equity. And so that's why I've really gone down a leadership path as well. I have to say it's really this is one of the hardest places I worked because of, we're so new and we don't have as many resources as some other medical schools and organizations do. But one of the reasons I love working here is that every single person here is here for the mission. And it's great to be at tables with people where we're all working together to advance equity and inclusion and training the next generation of healthcare professionals that we need to see in our profession that we don't see enough of. And so that's like really awesome. And so that's why I've taken the leadership journey. Number one, I like it. Number two, it gives me more influence than I would have in another setting. Um, and I also am really passionate about seeing women advance as leaders. Um, uh, Women have skill sets that have been completely undervalued in the leadership space, but we actually have a lot of social science evidence that are highly needed and lead to great success as leaders in the workplace. And so I'm also want to be a role model for that, and also kind of part the ways for people. I sometimes joke with people that I'm kind of like the what I want to say, I'm kind of like the snowplow trying to make a way for other people because it's not always easy when you're trying to make that path for others. But here it's a lot easier than any other place I've been, thanks to Dean Diaz and so many people. But so that's why one of the reasons I love working here. But that's why it's also just that's another way to influence policy is by being a leader. You have an opportunity to say yes or no to things. You have an opportunity to say, we can do that, we can't do that. So yeah, I have colleagues too are elected school board members or elected, I didn't even talk about that, elected local or federal Congress people, as you know. And so that's another way to influence policy is through going out there and running yourself.
Amazing. Thank you so much. Are there any other questions from anyone? Awesome. Okay, I think
Awesome. Well, you all met me, and if you have any other questions or want to reach out to me for anything, just you know how to get in touch with me. I'd be happy to meet. It was great. This was really fun talking to you. Thank you for giving me an opportunity to talk about something that I'm passionate about and help you with your passions. And if for some reason you want to do some local advocacy program, we should get together and talk about it and how best to approach it. Let me know.
awesome.
I'm also an AMA member, so maybe I can help you with the AMA. It was really nice meeting you all and getting to know some of you. It's really a pleasure.
Thank you.
Thank
Have a great
you.
day.